TJACH came together in response to federal funding from Department of HUD to address homeless issues. And I think in a right move by HUD, they required that there be a local entity in charge of overseeing how homeless services were being provided in the community, that needs are being met adequately, and that local decisions could be made at the local level about funding, about services.
We provide strong support through the affordable rental community and housing and financial counseling.
We're kind of a hybrid between a social services agency and a construction company, and we go out and we fix up people's houses.
We started taking on some federally funded housing programs, including rapid rehousing, homelessness prevention, a veterans program.
We're generally a healthcare system providing direct services around clinic visits, hospital visits, and kind of any kind of direct clinical care services that you need.
I think CBOs would consider joining a network because they understand that they cannot do it on their own. And I mean do it meaning solve the issues that each one is trying to solve or trying to achieve on their own. I think CBOs understand that working together exponentially increases the power of the services that we can provide.
I'm here working with Anthony at TJACH and other providers because we are going to be best serving our clients when we're actually all working together.
You know, if you look at it as a spectrum, we're occupy different parts of the spectrum, which I think is healthy because we need to make sure that all those spots in the spectrum are filled.
All of the organizations in the Charlottesville region that are providing housing-related services or health-related services, the vast majority of us are relatively small organizations. We are all strong and high capacity in many ways, but we also have fairly small staffs. So the idea of being able to come together and work as a coordinated body to make bigger and more thoughtful change and to be more effective in the service delivery that we provide, that feels like the strongest potential.
So the thing I'm most excited about with working with this network is what it's going to do is provide a substantive and methodical framework for us to really connect the dots between housing and health. Healthier people are more likely to hold on to their housing, and good housing makes people healthier, so it works in both directions. And I make that case all the time. So to be able not only to help promulgate that and make sure that we're getting there, to be able to have the data from other organizations helping to inform the work and make sure that we're communicating that to other stakeholders, not just to support AHIP, but to support the whole idea of affordable housing is pretty great.
We've really gotten to, over the last couple of years, start to share data with each other, start to look at kind of the common individuals and community members that we both serve, and how do our services overlap, and how could we better coordinate together so that we can better meet the needs together.
I think that's the thing I'm most proud of about TJACH is the people that we work with, and we wouldn't be able to do the work we do without those people at our provider agencies. So.
In my primary care office, I have a really incredible man who comes to see me for high blood pressure and diabetes care for his primary care and to get his medications. But he also is seen by TJACH and their broader collective organization, so spends a lot of time at the Haven, which is one of our day shelters for individuals who don't have housing currently. And so this patient of mine, through partnership with TJACH, is working on getting stable, supportive housing, which will be really helpful. And at the same time, he's contributing back into his own community. And so he's actually been a really big bridge for me into TJACH